Hey guys, this is Dr. Chafu, hair transplant surgeon, hair loss coach. Help thousands of my clients regain confidence through hair regrowth and hair transplant. So, a couple of days ago, I asked this question: this picture one and picture two, which one do you think is a complication from hair transplant? And we went through, we talked about, discussed it, but I just want to put it side by side and kind of show you the things what you need to watch out for, especially if you're going for a hair transplant or thinking about a hair transplant, or you have a loved one that is about to go for a hair transplant. Send them this video. This video might help them. And I hope you watch this video to the end because it's very important for you to understand the differences between them. So we're going to be talking about the differences between these two pictures here. Picture one, I already told you, is a normal scabbing, which is a normal healing process after a hair transplant. Then picture two right here is a complication, which is a rare complication from hair transplant. So how do you know? Hey, Dr. Chafu, how do I know what to watch out for? Now, let's see this picture one. If you look at this picture one, it looks like, you see, it's something you can peel off. Look at how it looks like. The scalp tissue is lifted from the skin. You can look at it. Look at the picture. You can see you can basically peel it off, but it's not advisable for you to peel it off. You only have to moisturize a little bit, spray with the hair serum that was given to you or whatever that was given to you to wash your scalp. After spraying, allow it to sit in, you massage it into your skin, then you scrub and get it off, okay? Because you don't want to damage your graft, so that's the safest way to do it. So you can see, then why picture two, you can see it's part of the scalp skin. You see, it's flat, so it's part of the, so you can see the demarcation around the area, the dead skin, the necrotic skin. You see the difference. While this other picture, you can see that the scalp tissue is everywhere in the transplanted area. See the difference? So that's very important what you need to watch out for. Now, if I'm looking at judging by these two pictures, I think they're likely in 2 weeks, 10 to 14 days, both of them. Then you can see scalp necrosis in this second picture right here. It can start as early as after the hair transplant. You can see small black areas, and that's why at Havila Hair Restoration, we advise our clients to send us pictures every other day so that we can take a look at it, because sometimes you might not know what is going on at home. So we will be able to watch out for things like this, because it can typically start like just as small as just a pea size, then it can grow into something really large. So that's why it's important for you to follow up with your hair transplant surgeon, especially after your hair transplant. Now, why scalp tissue or this scabbing you're seeing in this picture one, typically you can see it after 7 days, that's 1 week to 2 weeks. If the person is not properly washing and scrubbing their scalp, that's when we typically, because it's almost like dry tissue on your scalp, you see? So we don't see it as early as after the hair transplant. No, we don't see it. We see it couple of days, a couple of weeks after the hair transplant. The dead tissue, which is a necrotic skin on the picture on this side, we can see it as early as, after the hair transplant. And another key difference between these two, picture one, once you aggressively scrub, it goes away. But picture two, no matter how much you scrub, it's not going to go away because it's a dead skin. So a couple of treatments you can use: apply silver nitrate paste to the area. You can use nitroglycerin paste that will help to improve blood supply to the area. You can go to a place that has hyperbaric chambers. You do a couple of sessions that will help you improve oxygen flow to the area. And also, debridement of the area is also a suggestion. A couple of weeks to months for it to resolve. And I tend to see people have long-term complication from this. It can also cause scarring alopecia, and you're going to have hair loss in that area. And you might have to have a second hair transplant procedure to fix the issue. I hope this explanation has helped. I hope you understand that complications from hair transplant needs to be taken seriously. So it's not just a process. It's a lifelong process that you need to always watch out for and take care of your hair and your scalp. So if you're the person dealing with hair loss and you're thinking about a hair transplant and you don't know what to do, there's one recommendation: make an appointment with us. We offer free virtual appointments 7 days a week. If you say you're busy on weekdays, you have weekends to make an appointment. If you say you're busy on weekends, you can make an appointment for weekdays. So somebody can talk to you and help you go on this journey of hair regrowth. Until next time, bye-bye.